So by definition, endometriosis is the presence of normal endometrial tissue that is abnormally implanted in locations other than uterine cavity. These implants, they grow and invade tissue in their vicinity, causing inflammatory reaction. So 1 in 10 women of the reproductive age group, they develop endometriosis during their lifetime. Then 30 to 50% of the women with endometriosis are infertile. 25 to 35% of the infertile women have endometriosis. So the prevalence is, it is a highly prevalent condition, and especially at the younger age, at onset, predicts more severe disease. That means if the woman develops endometriosis at an earlier age, she has a more severe disease. At the recent estimates, about 96 million women, they do suffer from endometriosis globally. This is according to WHO data. And among this, nearly 50 million women, they belong to India alone. So, according to the infertility population, 25 to 35 or even 40, and 75% of the women with chronic pelvic pain, they do suffer from endometriosis. And 40 to 60% of the women with severe dysmenorrhea, that is painful menstruation, they also suffer from endometriosis. So, what is the average diagnostic delay? See, the girl starts having menstruation at the age of, say, roughly 11 to 13 years. But sometimes the symptoms starts even before that. So it can happen, the symptoms starts at the onset of menarche, but it may be around 1 or 2 years she takes to undergo the first consultation, and finally when the diagnosis is arrived, it may take 6 to 7 years. So primarily, average of 8 primary care visits before the specialist referral happens. That means the symptoms are variable, but the evidence for endometriosis clinically, it starts appearing only in the advanced stages. So the young girl suffers from severe symptoms like pain, abdomen, and dysuria, dysphagia, hematochezia, and ultimately depression. So the patient would have consulted a general physician. She could have consulted a pediatrician because of her young age, then psychiatrist, and sometimes by the diagnosis is made by the proper gynecologist, it would have been 6 to 7 years or later. So what is the natural cause of the disease? See, generally there are so many patients with the reference of so many authors. According to the American Fertility Society staging of 1 to 4, the progression depends upon the percentage. For example, the progression of all the patients who develop early endometriosis, they do not progress into endometriosis. Only nearly 30% of the patient, they progress. 30% of the patient, the disease remains stable. And again, 42% of the patient, it regresses.